I'm Kunkel, a plastic surgeon in Fort Worth, Texas. If you have some loose skin, maybe a little extra fat around your tummy, your flanks, and you want to know how we get rid of that when we do a tummy tuck, let's take a look. I'll show you how I typically do it. So how do we do it? How do we get from this to this, and from this to this? When I'm doing a tummy tuck and liposuction of the back and flanks, I typically start with the patient lying flat on her stomach on the operating table, and then I'll make a few small incisions about as shown here, and then I'll do liposuction of these areas. And here I am doing liposuction of these areas on a different patient. Then I'll turn the patient over and I'll do liposuction of these areas in the front. Now that we've enhanced the contour by getting rid of that unwanted fat, we need to get rid of the extra loose skin. That starts with a long lower abdominal incision. We carry that incision right down to the muscle layer, and we start lifting the deep tissues off of that muscle layer. We call that undermining. We undermine the tissue all the way up to the belly button. Then I make a small incision around the belly button, creating a hole in the skin that allows me to separate the belly button. The belly button stays right where it is. We don't move the belly button. It's going to stay right there. But by doing that, I can now undermine all the way up to the breastbone. Next, in most cases, we're going to address the rectus muscles. These are muscles that run from the rib cage to the pubic area, and they get stretched and separated a bit with pregnancy and with weight gain. In most cases, we'll pull the inner edges of those muscles together. That creates a real flattening effect from a profile view. Some people refer to that as an internal girdle. Once that's done, we're going to grab that skin and those tissues right where we made the incision. We start pulling it down toward the knees. So all that tissue starts to move down. That little incision we made around the belly button starts to move down. And once I've pulled it as tight as I can, we'll cut off quite a bit of tissue, usually about this much. And here's what we actually cut off of this patient. Once that's done, we stitch everything together. That results in a long scar about like this. And we have to make a small incision right over the belly button, and we pull that back out, so people end up with a scar around their belly button as well. Now let's take a look at this patient's result. But first know that she's 39 years old, 5 feet 3 inches tall, weighs 147 pounds. She has 3 children, and during the surgery we took off 10.5 inches of skin from below her belly button, and we removed 1,300 cc's of fatty tissue and fluid with the liposuction. Here she is from the front, from the back, from the side, and here's an oblique view as well. That's how we did this woman's surgery. I won't do it the same way on each person. I'll tailor the procedure to the individual depending on what her desires and what her findings are. And because of that, different people will get different results. If you've been thinking about tummy tucks, take a look at our website. We have 50 or 60 cases of before and after photos, lots of videos, lots of information. If you've been thinking about it, give us a call. We would love to see you in our office here in Fort Worth. In Fort Worth, keeping it beautiful. I'm Kunkel.